You have had that out of 2,000 people who are screened, 450 among the children, 450 of them are positive. That is a rate of almost 22%. I think that is a very serious matter. I cannot imagine. I know diabetes is a lifestyle disease. It's a disease based on maybe diet, and our lifestyle activities. But the prevalence among young children, I think it's absolutely nothing to do with lifestyle. So it's one which we will encourage. Maybe there should be more research to find out what is it that is causing this diabetes among these children. Somebody just gave me a note and say that there has been research that spaghetti is one of the things which causes diabetes in the community here. But I can assure you that no child eats spaghetti.
So all the information by Safaricom.
Thank you very much. My name is Henry Kilonzo. I'm a senior manager at Safaricom Foundation, in charge of programs. Today we are here at Garissa County Referral Hospital to launch this child-friendly diabetes management center. We constructed the fully equipped center to enable the county to effectively manage type 1 diabetes for children aged 21 years and below. Why we came to Garissa is because, looking at the statistics, Kenya gets around 1,000 cases of type 1 diabetes every year, and Garissa is one of the counties with the highest number. And that's the reason we made a decision as Safaricom Foundation to come to Garissa. The Center of Excellence is part of a bigger program for the 3 years, and we started in 2019, which focuses on 3 things. One is to create awareness at the community level about type 1 diabetes, so that the communities can know that it exists and the children need to be taken care of. Number 2 is to ensure that children with type 1 diabetes are referred to the health facilities for management, so that they can access the nutritional counseling, they can access the drugs, they can also access any healthcare service related to type 1 diabetes that they may need. And number 3 is to ensure that the facilities are state of the art in terms of managing type 1 diabetes. For example, this kind of facility, which I think is unique in Garissa County, you see it has the nutrition, it will provide nutrition services, it will provide screening services, it will provide psychosocial counseling services, it will provide the medicine or the drugs required for the management of diabetes for children. Thank you very much. This is the first for us in Garissa, and now we are looking at expanding to other counties, 2 or 3 in the next few years, where we will also ensure that similar, state-of-the-art, facilities are also available. And we are not just focusing on the facilities, but we are looking at strengthening the healthcare system within the counties to ensure they provide the required treatment management services for children. For example, in Garissa, we are working with 100 community health volunteers who are in the different villages. And those are the ones that each and every day look for these children, work with them to the facilities to ensure they get services. Number 2, we have trained healthcare workers in the health centers or in health facilities in Garissa to manage on how to manage type 1 diabetes. And because most of the children spend time in school, we are also training teachers as champions of type 1 diabetes to ensure that they are able to support these children psychologically. They are able to also, identify some of the signs and then refer these children to facilities for screening and further management.
Finally, Your Excellency, it is estimated that about 500,000 Kenyans have diabetes. Unfortunately, only 40% are aware. 60% are not aware that they have diabetes. Your Excellency, therefore, our biggest success in this program has been creating awareness. Over the last year and a half, we have contacted at least 50,000 residents of your county, engaged them, created awareness, and they now know.
Kwa majina naitwa Nimo Adan. Mimi ni mhudumu ya hii hospitali. Bado niko na mtoto ambaye ako na sukari, ambaye ni msichana. Niko na watoto 4, mtoto wa 3 ndio ako na sukari. Kwa family hatuna diabetic cases. Babake ako sawa, mimi niko sawa kifamily. Msanangu anaitwa Marwa. Marwa alipata sukari akiwa na miaka 3. Sasa yeye ako na miaka 7. Ako na 4 years. So the first 2 years ndio nilipata shida sana kwa kumanage sukari yake. Madawa ni expensive. As a mother nimepata challenge hata kama niko kwa inside hospitali, najua watoto wako nayo, lakini ilinisumbua sana. Lakini sasa sukari yake iko manageable. Tulipata dawa ya bure, inatusaidia kwa wakati wote. Hii program ilitusaidia sana ilitusaidia sana. Inatusaidia kwa saidia dawa moja inauzwa 1200 na mtoto anafaa kutumia dawa 3 kwa mwezi. Moja usiku na 2 ya mchana. Moja usiku inauza 1200 na ya mchana moja inauzwa 1200. So ilitusaidia sana kuwa tunapata wakati wote, tunapata bure. Watoto wanafanywa appointment ndio wakuja wapate dawa inapoisha. Facility ni leo, lakini dawa hatukuwa tunanunua dawa, tulikuwa tunadispensiwa tu kwa hospitali through Safaricom program. Lakini facility kufunguliwa kuwa hatukuwa na mahali ambaye iko kando ya ambaye watoto wa sukari wanaweza kuhudumiwa. Lakini sasa tunafurahia sana kuwa tumepata at least mahali ambaye watoto tukitaka nutrition, dawa, consultation, anything tukipata in one place. Imetusaidia sana, tunafurahia sana.
In case maybe a person has the disease, what is the prevention measures you can take, including screening, early detection, treatment adherence, seeking health service help, and mostly educating. Because if you are educated on what is causing diabetic, then you will be it will be able to prevent by applying those preventive measures. That is the kind of food you are taking. In case you may be having the disease, you can get an early intervention and testing and screening services you undertake or access to it at the facility level.
Over the coming months, we want to do a few things. So one, we want to do a medical camp in Dadaab. And our intention is over this period to be able to bring a further 500 children into the program. Your Excellency, sir, we also want to do training to teachers, both in school and in madrasas, as well as do training to other facilitators who will help us to reach to a greater height in the community. We believe that without supporting ecosystem, we will not be able to continue the work that we have started. In this regard, sir, allow me to appreciate PGI once again and the County of Garissa for the support that they've rendered to us.